Hi, Minister. Jack Howan with the Trillium. How are you?
Good.
I just wanted to ask you about some modeling that the Ministry of Health has put out saying the government will be connecting 98% of people to primary care in the next several years. Does that include online visits or is that in-person primary care?
So the modeling is really a combination of the work that we're doing in medical school expansion, in residency seat expansion, all of the pieces together. Primary care, as was mentioned, multidisciplinary team expansion that we announced in February. And we're already seeing those teams have started to recruit, retain, and are taking on new patients. So all together, all of the pieces that we are working on as government to make sure that we have access and ensure that for decades to come, our system has enough clinicians in Ontario practicing and licensed.
Right, I understand the process, but the question is more about the modeling itself and the results. So if you wouldn't mind answering the first question, and then also, how many years is several?
So as I mentioned in my previous answer, it is a combination of all of the work that we are doing together. It is not just primary care expansion, multidisciplinary teams. It is not just residency seat expansion. Every single medical school in the province of Ontario has already seen an expansion of their residency seats. Of course, that isn't even including the work that we are doing on 2 brand new medical schools. In Brampton alone, we will see a new medical school opening in the fall of next year. So all of the pieces together are where the modeling gets their results and their numbers. Thank you.
Hi, Minister. Rob Ferguson from the Star. Just wondering, what kind of fees are you contemplating? Would they be similar to the fees that pharmacists are already getting? And could you outline what they are and how they compare to what a doctor would get for a similar visit?
So the work that we are doing right now is on the consultation of the actual items that we are considering expanding scope of practice. It does not include discussion or conversation about fees.
Okay, could you just answer the one, what are the fees now? Like, is it a set fee for every consultation?
We will not cover fees today. Thank you.
But I'm asking what the fees are you're already paying. Surely you know that. You're the health minister.
We will not be covering fees today. This is a consultation on the expansion.
I get that, but what I'm asking is, what are the fees you already pay?
We're not covering fees today, Rob.
Okay. How many applications have you got yet for well, I was trying to get an answer to my first question, which she's not answering. Yeah. So.
Are you having a debate amongst yourselves?
No. It'd be nice if you would answer a simple question. It'd be nice if you would answer a simple question. But anyway, how many applications have you had so far for the private clinics? And is the deadline still August 12th?
So the application portal is open right now. So we are seeing a lot of interest across Ontario on an expansion of diagnostic opportunities in the province of Ontario. And until the assessments have been made and the reviews have been made, I would not be able to share the numbers of actual applications to date because the portal is still open.
All right, next question. Thank you.
Hey, Minister. Good morning. Colin DeMello with Global News. Wanted to ask about nurse practitioners. So last time we had kind of checked in, you guys had sent a letter to the federal government asking for clarification on the Canada Health Act. The Minister of Health indicated that there has been some behind-the-scenes conversations with all of the provinces about what that should look like. Can you give us a sense of where we're at with nurse practitioners perhaps being independent operators similar to doctors within our healthcare system in Ontario?
So, as you know, in Ontario, nurse practitioner-led clinics, Ontario actually led the country in terms of embedding them in our publicly funded system. And with our most recent primary care expansion that we announced in February, some of those 78 expansions included nurse practitioner-led clinics. So we want to ensure, with conversations with the federal government, that what we have in place in the province of Ontario, nurse practitioners as part of multidisciplinary teams, standalone nurse practitioner-led clinics can continue to operate within the publicly funded system. I think in my letter to the federal government a number of months ago, I made it very clear that we see an important role for nurse practitioners and the clinics that are operating within the publicly funded system, but we also have to ensure that patients are not charged in one part of the province for a procedure or a visit that is publicly funded under the other. And that is, frankly, the loophole that we are very seized to ensure that the federal government closes.
As you mentioned, though, you wrote them months ago.
I did.
Can you give us a sense of what is taking so long, and are you disappointed that it's taking this long? For clarification.
Yeah, you know what, Colin, I can't speculate as to what the delay is. All I will say is we see and we know, and through our actions, we have proven that we understand and value nurse practitioners and the clinics that they publicly fund. But there is an issue with people operating outside of that threshold.
Okay, can I just ask, could you give us an update on AI Scribe? That was something that obviously your government has had a pilot project. I believe it was about 150 or so. How is that going, and are you looking at expanding that now?
So the short answer is the AI Scribe is going very well, but it is, to your point, in a limited rollout right now. We want to make an assessment. We are working directly with clinicians, physicians who are using it. I can tell you anecdotally that they have been, to date, very impressed with the accuracy and, frankly, the willingness of patients who are embracing that opportunity to have a conversation and then ensure that all of that information is accurately depicted in the written record.
Thank you, Minister. And as regards today's announcement, I understand you're still consulting. You can't talk about...
We're just starting the consultation.
Got it. But since the pharmacists already you have expanded their role already. Can you give Ontario taxpayers an idea about if this is going to cost them more as opposed to doctors continuing to do all of these assessments and prescriptions? Is this going to be an extra cost to Ontarians?
You know, for me, this is about access. So as Justin Bates articulated, you know, we've had over 1 million assessments since we made the initial scope of practice changes. We are doing scope of practice changes consultation and discussions with many of our regulatory colleges. You have seen some changes most recently with midwives, with registered nurses, with nurse practitioners. We want to make sure that all of our healthcare practitioners are operating within their scope of practice to ensure that the patients and the public have access and options. I think it's really important to focus on how does this improve that patient experience. And if I, as a patient, can go into my local pharmacy instead of having to take time off work, instead of having to go to an emergency department, instead of having to see my general practitioner, that to me is an improved access and outcome that we all need to strive for. And that's what all of the conversations are when we discuss scope of practice. You know, we didn't touch on it today, but the scope of practice changes that we have done to date and we are currently beginning consultation on is scope of practice that is already being taught in Ontario colleges and universities. And to me, we need to make sure that we're accessing and utilizing these highly skilled practitioners at the highest scope of their practice.
Hi, Tina Danny with City News. So can we take from that answer that it will cost more to pay pharmacists to do these things than family doctors?
No, not at all. What you can take from that answer is that we are ensuring access. It's not an either or. It's not an option. It's an option to patients to ensure that they have a choice. They have a choice to go and have a conversation with their primary care practitioner. They have a choice to visit their local pharmacy and get the treatment they need. And 1 million visits in just over a year and a half suggests to me that the people of Ontario are absolutely embracing and accessing this option.
Shouldn't that also suggest to you, though, that there's a lack of family doctors? And we've recently heard new data that 2.5 million Ontarians are without a family doctor. Are you using pharmacists as a replacement here?
You know, we've also, as you know, made expansions and investments to ensure that people who want have access to a primary care practitioner. In February, 78 new or expanded primary care multidisciplinary teams were announced. This is a government and a ministry that is working on all parts of the system to ensure that we have sufficient capacity, that we are training sufficient numbers of healthcare practitioners. You know, the last time in the province of Ontario that we had a medical school expansion was over 15 years ago. So we're making those investments. When you see capital infrastructure of over 50 new capital builds to ensure that we not only have as the health human resources to ensure that the existing additional 3,000 hospital beds that were opened up during COVID, we're also building another 3,500 hospital beds. We need to train practitioners for those opportunities, and that's what we've done. Whether it is how we have directed the College of Physicians and Surgeons of Ontario and the College of Nurses of Ontario to quickly assess, review, and ultimately license when appropriate, internationally trained and educated practitioners. We're working on all parts of the system to make sure that the people of Ontario have access in their community and as convenient as possible.
Minister, why aren't we covering fees today? Why isn't that something you want to disclose to the public?
Sorry, Minister. Do you mind just answering the question? You've been asked multiple times now. I get it. It's about access. That's fair. But the question is, is a pharmacist billing less than a doctor? And are Ontario taxpayers saving money as a result of those million visits? Please don't shut us down.
I'm not shutting you down. What I'm saying is the consultation that we are announcing today has nothing to do with the fee component. We are talking to the public and the OMA, the Ontario Pharmacy Associations, to make sure that the proposal of 14 new expanded scope of practice are the appropriate ones for us to move forward on. It is a separate and distinct difference between any conversations about compensation.
This will be the last question.
Well, something that was mentioned in the announcement today, you were talking about improving the Meds Check program. I have heard that there has been some work on this already, that the forms for the Med Check program have been changed to make it clearer about when consent is obtained from someone who is being called up and asked about their medication. What specifically are you proposing in these consultations to change the Med Check program to stop further abuse of it? And what have you done already?
So the reason we've included the Meds Check review is, as you probably know, Meds Checks began almost a decade ago. And it is an appropriate time for us to review that program to ensure that it is continuing to add the value and has the patient focus that it needs. We are actively in consultation, and including the Meds Check piece of it ensures that we not only have the feedback from pharmacists, but we also get that feedback from the general public, from our other primary care practitioners.
So what are you consulting on? What is the proposal here?
So the consultation would include, we know what the Meds Check program looks like currently, and how can it be improved? What value is it bringing to both patient outcomes and ensuring that how it began 10 years ago is actually how it is being used and utilized to improve patient care today?
I mean, we know that it's not. So are you looking at shutting this program down?
That is your opinion.
It's being abused by companies.
Thank you, Alan. That concludes our media portion for the event.
We still have.
Okay, sorry, Barbara.
Minister Barbara with Queen's Park Briefing. How are you?
Very good.
I just want to ask you again about the modeling connecting people to primary care. 98% is a very impressive number. Since the modeling wasn't released to the public, can you just elaborate a little bit more on how the government came up with this number?
Okay, I will go over the data that built the modeling. 2 new medical schools, Every medical school currently operating in the province of Ontario has additional medical seats as well as residency positions. Expansion that is not only in process right now, but is in planning stages for future. All of those pieces together drove the modeling numbers.
Can you just be a little bit more specific than that? Because just like graduating students won't be necessarily going to primary care after they finish their studies, right?
Well, actually, we have the data that shows how many tend to, and of course, with the CARMS matching, it shows which specialty individual doctors are choosing, so you can actually drive out some of that data to
and will this modeling
ultimately
be
work the
available
modeling.
to
And the other
public?
piece that I think is really important is Ontario leads Canada in terms of how many patients are matched with primary care clinicians. We already lead Canada with over 90%. We're putting the processes and doing the work to ensure that that number continues to drive up as we see increased population in the province of Ontario.
And why this modeling wasn't released just yet?